Hello, my name is Hagen Kennecke. I'm a medical oncologist and professor of medicine at the Oregon Health Sciences University Knight Cancer Institute. And I'd like to talk today a little bit about cabozantinib and its recent indication for the treatment of patients with advanced neuroendocrine tumors, and specifically about its role in improving progression-free survival. Now, while we know that overall there was a significant benefit in both PNET and EPNET patients in terms of PFS, there was some notable differences between the two groups, and I want to talk about that. In terms of the PNET patients, which represented about 1/3 of the whole entire cohort of the CABINET study, the overall the patients in this group, over 90% had liver metastases, and about 60% had been previously treated with Lutathera, PRRT. Overall, there was a significant improvement in the risk of progression, a 78% reduction in PFS, and a response rate of 18%. So overall, there was a median progression-free survival of 14 months in the PNET patients treated with cabozantinib. In looking at the patients with EPNET patients, which were quite diverse, including lung nets, thymic, and as well as small bowel predominantly, these patients comprised about 2/3 of the CABINET cohort. And again, 90% of them had metastasis to the liver. And the hazard ratio in terms of progression-free survival was 0.4, so a 60% reduction in risk of progression. All the subgroups benefited, and there was a fairly consistent prior exposure to Lutathera in both in patients, and there was response regardless of prior therapy of PRT. One of the last subgroups that we've seen of interest from the CABINET trial was the G3 nets. And these are traditionally, as we know, quite a challenging populations to treat. And this data was presented at ESMO. And while it is a smaller subgroup, it was about 25 patients, the majority of which were G3 PNETs. But here again, we saw a consistent hazard ratio, and in this case, 0.15, so an 85% reduction risk of progression with the treatment of cabozantinib. And the majority of this benefit was carried by the PNETs. So overall, to me, this suggests that regardless of tumor grade and site of origin, patients with previously treated neuroendocrine tumors, cabozantinib does offer an active treatment option, and I think is a good treatment to consider and discuss with our patients.